Hello, I'm Dr. Ramsey Amin of www.burbankdentalimplants.com and dentalimplantdentistryblog.com. Today I'll speak a little bit about the Locator Overdenture Attachment. If you search on the blog, and I'll create some links for you to learn a little bit about what an overdenture is. An overdenture is for somebody typically who already has dentures, who's looking to get stability of their existing lower or upper denture, to have their dentures lock into the bone. There's many different types of attachment mechanisms of how to actually attach the denture to the implants themselves. Sometimes they're attached by bars, sometimes they're attached by O-rings. They kind of look like a trailer hitch type of mechanism, and other times we use a mechanism called a locator attachment. A locator is more of a modern and contemporary type of attachment, and it really does save a lot of money when it comes to restoring your dental implant overdenture. Locator attachments come in different retention abilities, we call them, meaning we have control of how tight or how loose your denture will hold in place. I have some older patients well into their 90s that may not have the dexterity and strength within their hands to remove their overdenture, so we actually have had to remove and replace some attachments over time. The average lifespan of an attachment, now these attachments, the attachment that goes inside the mouth is made out of a type of metal, oftentimes it's titanium, that screws to the implants themselves, and on the underside of the denture there is a plastic type of mechanism that clicks onto the implant. Think of it as if you were opening and closing a door many times. That door hinge would eventually wear down. The average attachment, I find in my practice, lasts about 18 months to 2 years. I've had some patients go as long as 5 years with them, depending on what kind of food they eat, their diet, how much they take in and out their dental implant overdenture. But changing the attachments in the office is a very simple, straightforward, and cost-effective procedure. It's not expensive at all once you have an implant overdenture. The locator attachment is great. It works better the more implants that you have. On the lower, typically 4 implants is the best number. 3 is quite good. 2 is just minimal for some amount of hold, but 4 is definitely the standard on the lower. On the upper jaw, typically 6 attachments help to hold an upper denture in place and keep it held in place without losing bone over the long term. The implant attachments themselves are plastic. They come in either blue or pink or clear, depending on how much hold we want, like I've said. But the attachment that goes inside the mouth, that's the part that you'll see all the time. When you take out your denture, it will be there. You brush those, we encourage you to use what's called a rubber tip around the implants, and to visit us on a regular basis for cleanings around the implants. But dental implant overdentures are great. They are a fantastic alternative to full dentures. Dental implant overdentures still get food underneath them. In fact, sometimes you may get a little bit more food underneath because it's locked in place. It doesn't float around for your own saliva to wash things out. Obviously, a fixed bridge that stays in place all the time is the best. But dental implant overdentures have been around approximately 40 years at this point and are quite successful. If there's any questions, please feel free to comment below, and we'll see you soon. Thanks.